Hi everyone, I'm Dr. Kara Amstutz. I'm a veterinarian that focuses on pain management and rehabilitation for dogs and cats. And I'm here to talk to you about cruciate disease in dogs. Very common condition that we see in all shapes and sizes of dogs, all ages, all activity levels. And I want to talk to you about options for treatment during these times. So first, let's talk about the anatomy and physiology of the disease. First thing is the anatomy. This is a dog's stifle or knee joint. This is the femur or the top bone, also known as our thigh bone. This is the tibia or the shin bone for us. Inside there are some structures that are very important. There is this thick pad, which is called the meniscus, which acts as a shock absorber for the joint. And there are two ligaments that crisscross inside the joint. One's called the caudal cruciate ligament that starts at the back and kind of works its way forward. The other is the cranial cruciate ligament that starts at the front and works its way back. And those two ligaments help to stabilize the knee joint. Now out of those two, the cranial cruciate ligament is the one that seems to cause the most troubles. And it has a lot of important jobs. One of the things that it does is it prevents the knee from hyperextension. Okay? It also prevents the knee from what's called too much internal rotation. So the tibia rotating internally, it stops that motion. It also acts as a proprioceptive ligament, meaning it helps the brain know where that foot is in space. And then finally, it prevents what's called drawer. Drawer is a motion that when the dog takes a step down, the tibia wants to go forward and the femur ends up kind of going backwards. And that motion can cause abnormal wear and tear on this meniscus. So if that cranial cruciate ligament is damaged enough to where we've lost some stability in the joint, every time the dog takes a step, the tibia goes forward, the femur goes back, and now the femur and the tibia are kind of hitting in all the wrong places. It's causing damage inside the joint. It can cause tearing of the meniscus, which is painful and speeds up the process of arthritis. And this whole pathophysiology of this condition leads to kind of a progressive inflammation within the knee to the point that we get arthritis and joint dysfunction. So that's kind of the pathophysiology and the anatomy. Now, what causes that ligament to have a problem in the first place? Only about 10 to 20% of the time is it an acute injury. So in a humans walk around with a normal cruciate ligament, and then maybe they step in a hole and twist their knee and now they have a torn cruciate ligament. That happens in dogs, but not nearly as commonly as a more degenerative process. So we know certain breeds, certain dogs who are overweight have a higher chance of having cruciate degeneration. Certain conformation or how the bones in the knee are put together have a higher chance of having cruciate disease. And the way that I like to explain cruciate disease, it's kind of a slowly progressive, smoldering type of condition where if you think about a nice brand new rope where all the fibers are tightly coiled and the rope is very strong, that's like a healthy cruciate ligament. If you have a rope that over time has had some wear and tear and one strand gets broken and another strand gets broken and eventually it loses some of its strength, that's what we see with cruciate disease. And the symptoms that clients report to me, and if your pet has this condition, you may be seeing the same thing, is the dog is fine but tears off the porch to go after a squirrel and then comes back limping. And then maybe it's okay for a couple of days and then runs after a rabbit and comes back limping. And then maybe it's a couple of months and it tears off the deck after the neighbor's dog and now it won't put his leg down. So this kind of up and down, waxing and waning symptoms are very, very common with cruciate disease. And that's because each time the pet overdoes it, is too active and puts too much strain on that ligament, a few of those strands get broken and makes it more and more unstable. And so that's why you may have your pet be evaluated by a vet and they may say he's got a partial tear or they may say he has a full tear. And it just depends on how many of those strands of the ligament are ruptured at the time of diagnosis. So the way that we get an official diagnosis is twofold. Our examination, we find that the pet is lame or limping, has muscle atrophy, it's lost muscle on the side of the injury because they don't want to bear weight completely on that limb. They'll have reduced extension of the knee, there's too much swelling and maybe some secondary arthritis. And when we actually look to see if there's abnormal motion in the knee, we do a test where we basically hold on to the femur and see if we can push the tibia forward. And in many cases, there is what we call drawer, that drawer motion. They have too much movement, and that's because that cruciate ligament is ruptured. The other thing that we do is we'll look at x-rays, and x-rays will often show quite a bit of swelling within the knee, maybe some early arthritis. It may even show that the femur is sitting too far back, which would be a pretty good indicator that that cruciate ligament is ruptured. So that's how we diagnose it. Now, what do we do to treat? Well, prior to COVID-19, surgery was the best treatment, and it still is. Long-term is going to be the best treatment. But right now, surgery isn't an option. The American College of Veterinary Surgeons are not recommending that veterinarians continue to do elective procedures, and the TPLO is an elective procedure. So we have to figure out what can we do in the interim. So non-surgical treatment options are going to be, we've got a few options. One, you can focus on pain management and weight loss because many of these patients are overweight. We can get your pet started on a supplement of omega-3 fatty acid, which has been shown to reduce inflammation in joints and reduce pain. And so our goal with the supplements would be to slow down progression of arthritis. Finally, the other treatment would be to start your pet on Adequan. Adequan is an injectable medication that has been approved by the FDA to slow down the progression of arthritis. It has data to show that it does that. It's an injection that is given twice a week for 4 weeks and then on a maintenance schedule. So those would be the 4 things that I would want every patient to do if they have a cruciate injury. We would want to do pain management, weight loss if needed, omega-3 fatty acids, and Adequan. And then the next choice is, do we want to look at doing in-clinic formal rehabilitation, which is something that we offer here, which would include underwater treadmill, therapeutic exercises, and what we call restorative, which is laser therapy, manual therapy, massage. All of the things would be working towards the goal of reducing muscle loss, maintaining range of motion within that knee, and making sure we're controlling pain. So that would be an in-clinic formal rehabilitation. The other option, and an option that I'm really excited about because I am one of the study participants, is to enroll your pet into a study. The study is basically looking at dogs who have cruciate disease, and what I would like to do for you is formulate a home exercise plan for your dog and basically teach you how to do rehab in a home setting. We understand that it's kind of scary times right now, and bringing your dog to the clinic may be something you can't do. Maybe you've got more time on your hands and you'd like to do some things at home. Maybe the financial aspect of in-clinic formal rehab is a bit much right now. So I want to do something that can help you and your pet. And so we've got a study that's starting right away, and if you would like to participate in this study, we'd love to have you and your dog. Basically, what it would entail is we would do the initial workup just like we would prior to surgery. We need to get an official diagnosis. We also need to do some lab work, make sure there's nothing else going on with your pet, so that we know it's safe to start some of these pain management methods. We would want to do the pain management, weight loss if needed, and I'm more than happy to give you advice on how to help your pet lose weight. And the omega-3 fatty acids and the Adequan. So we would still do all of those things. And then we would give you some home exercises. We would need for you to bring your dog in 3 times. Once at times beyond the initial evaluation. So the initial evaluation, then at 4 weeks, 8 weeks, and 12 weeks. And at each one of those appointments, what we would do is get some outcome measurements. So range of motion, weight, muscle girth on the thigh, pain levels, those types of things. We'll get a video of them moving, get a lameness evaluation. So those are the things that we'd be looking at. And if you would be so kind to participate in this study, I think it would be very, very helpful. We've got to figure out what we can do for these kids if we don't have surgery as an option. And we know that there are some pets that surgery isn't an option ever, even when it is available, just because of finances or maybe they have health issues. But right now, because surgery isn't an option for us, this study must be done. And I would really appreciate it if you'd like to help with that. Please feel free to email me or give us a call at 417-860-2429 if you have any questions, and we'll be happy to visit with you. Thank you.